Are you in a relationship, married, or single? Well, whatever category you find yourself in, I have something important for you. If you plan on becoming a parent or having a child now or in future, then it's crucial for you to know these red flags in communication development. My name is Eugene Osei, a speech and language therapist, and welcome to the Speech Doc. Today, I'll be talking about communication milestones for children from birth to 5 years. When do babies start to coo or babble, like make those baba baba sound? How about when they smile? Cooing, babbling, smiling, and giggling are all examples of early communication milestones. Milestones, or developmental milestones to be more specific, are behaviors or skills that are typical or common within an age range. Long before your child says his or her first word, they have their way of communicating their needs and wants and even their feelings to us. So, communication milestone here refers to a roadmap of what to expect in your child's early years of life in terms of speech, language, and even hearing. While every child develops differently, milestones help us to identify red flags and when extra support may be needed for a developing child. Red flags don't mean there is a definite diagnosis. However, they do mean it's time to ask questions. Now, let's delve straight right into the communication milestone. If your child does not meet many of these milestones, then there is a red flag. From birth to 3 months, here are some milestones your child should be expected to achieve or meet. 1. Your child should be alert to sounds. For instance, when something drops on the floor and makes a loud sound, your child or baby should give a startle reflex. Also, the baby should be able to turn or look in the direction of voices or when people are talking. 2. Your baby should be able to keep quiet or smile when you talk to him or her. 3. Your baby should be able to make different sounds depending on whether they are happy, upset, or uncomfortable. 4. Your baby should recognize the voices of loved ones. For instance, if the baby is crying and mommy comes in and then mention the child's name, the child should be able to keep quiet or pause the crying for a bit, indicating that yes, he or she can recognize a familiar voice at that moment. 5. By 3 months, your baby should be able to coo. That's make sounds that are similar to the vowels, like ah, o, those type of sounds. So by 3 months, if a baby is not able to achieve this milestone that have been outlined, then there is a red flag and questions must be asked. Now let's move on to communication milestones from 4 months to 6 months. 1. Your baby should be able to giggle or laugh. 2. Your baby should be able to respond to different facial expressions. For instance, if you show a happy face, your baby should smile. If you show a scary face, your baby should show signs of fear. If you show a funny face, your baby should laugh. 3. Your baby should be able to look at objects of interest and follow them with their eye. For instance, if you show a colorful toy to your baby at that stage, he or she should be able to trace or follow the object as it moves from left to right. 4. Your baby should be able to vocalize during play or when he or she puts object in the mouth, make some sound. Those form of sounds, yes. 5. Your baby should start to vocalize different vowel sounds and then blending them. So making sounds like ah, oh, ah, eh. So the vowel sounds are being blended. 6. Your baby should be able to blow raspberries. And that's the sound we make when we put our tongue in between our lips. So the sound, exactly. So if your baby has not achieved this milestone by 6 months, then there is a red flag. You need to start asking questions again. Up next, we are now going to look at from 7 months to 9 months, the milestones that are expected for a developing baby or child. 1. The baby looks at you when you call his or her name. 2. When a baby pauses for a while when you say a firm no. 3. Now, during this period, your child should start babbling. And we say babbling, that's using of the consonant sound and then adding the vowel sound. So saying the ba, 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 ma, da, 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 ba, da. So blending consonants with the vowels that they used to call previously. And usually, this babbling matches with the child's or the language being spoken at home. So by 9 months, most babies are able to crawl, some stand, and even some begin to take their first step in walking. So at this stage, they might also your child is expected to raise their hand to be carried or even walk to a loved one when upset or when it's crying. Finally, your baby should be able to push away unwanted object. So if you bring an object close to your baby and your baby doesn't like that particular object, he or she should be able to use the hand to push it away. So between 7 and 9 months, if your child or baby is not able to do most of these things that I have mentioned, then again, there is a red flag. Now let's move to the communication milestones from 10 months to 12 months. That's a year. I guess at this point, I don't have to say baby anymore. I'll be using more of a child. So by 10 months, your child should be able to reach for object of interest or preferred item. Also, your child should be able to point, wave, or give you back object or item. 3. Your child should be able to imitate and then initiate gestures for social interactions. For instance, blowing kisses or making some funny face for you to laugh, or playing peekaboo game where your child tries to cover your face or tries to hide when he or she sees you approaching. 4. If your child tries to imitate the sounds you make. 5. Your child responds to simple words or phrases such as bye bye, look at mommy. Finally, your child says one or two words like mama, dada, bye bye, or any word that the child has said over and over again. So, a very familiar word that has been used around the child for a very long time. The child starts to repeat such a word. So, if your child is unable to achieve many of these milestones by 1 year, then there is a red flag and questions need to be asked. If your child is delayed or hasn't achieved all these milestones by age 1 or 12 months, what can you do to help? Well, here are some tips for you. 1. Pay attention to your child's hearing. See if they tend to noise or look at you or in your direction when you speak. Look for signs like crying while pulling on their ear, as this could indicate an ear problem or infection. You can see an ENT or an audiologist to address that. 2. Respond to your child. Look at them when they look at you. Talk to them when they make some sounds. Also make such sounds with them. Laugh with them. Make silly face to get them excited and laugh with them. By age 1, you can try to teach your child copy action, such as saying bye bye, so holding their hand to also wave, blowing kisses, playing peekaboo. This teaches the child how to take turn and also use gestures. Also, talk about your day to your child. For instance, when you are cooking and your child comes around, you talk about the activity you are doing. Mention the child's name. I am cooking. You pick any ingredient, you model the name of that ingredient to the child. This is an onion, this is tomato, it's going in the pot, this is fire. Try and label everything around your child and exaggerate the way you speak when trying to communicate with your child. Make the lip movement and the voicing very obvious and easy for the child to also see when trying to engage them in communication. Oh, and whatever you do, or no matter how busy you are, No screen time for your child until they are 2 years. This will be a topic for discussion for another video, but I repeat, don't introduce screens to your child until they are 2 years of age, meaning no watching of cartoons, no watching of rhymes or anything on the TV, on the phone, on tablet. Again, until your child is 2 years, don't introduce your child to screens. Rather, give them physical engagement. Get toys for them or engage them face to face or one on one yourself. In addition, you can sing, tell stories, read books to your child every day. Finally, seek for professional help, a speech and language therapist to be specific, when you notice these red flags are very prominent and show no signs of improvement by age 1. Stay tuned and get ready for our next video where I'll be focusing on communication milestone from 13 months to 24 months, that's 2 years. Remember, as long as you plan on becoming a parent and having a child, take note of these red flags. And kindly share with family, friends, and across all social media platforms as we continue to create awareness. This is the Speech Dog. Don't forget to follow and subscribe. Thank you.